Hello, and welcome to Reed Scholars Live. I am your host, Dr. Mary Fleming, and current president of Reed Scholars. I am joined today by Dr. Cameron Matthews, who is the Assistant Undersecretary for Health and Clinical Service in the Veterans Administration. Welcome. How are you today?
You. I'm very happy today of all days, but it's great to join you. I'm excited to talk today.
Well, I'm excited to talk with you. And, I know you already and a lot of things about you, but I think where I would like to start and where I think people would be interested in learning a little bit about your journey to medicine and also your journey to policy, because you don't have just an MD, you also have a JD, which is relatively unique in this country. So tell us a little bit about, why you chose both, why you chose to do them together, and then we'll get into how you're kind of using them now.
Oh, I love it. Thank you for that. So medicine was always a given for me. I think I can't remember a time where I wasn't interested, particularly in primary care medicine. I even knew early on I wanted to do family medicine. Then it really started to turn into, though, but what does that mean? What type of doc do I want to be? And I knew off the bat it wasn't just to be a clinician. I knew I wanted to, what I thought was initially more leadership. Then I thought it was maybe the business of medicine, which I have actually ended up being more in. Then I thought it was public health. So many of us do the dual degree in some form, right? But I had a great experience and thankfully great mentors. I worked on Capitol Hill one summer, my first summer after medical school, first summer of medical school, and really absolutely started to, I think, appreciate really just how we in healthcare don't really, I would say, have control of the leadership of our own field, right? We don't make the laws, we don't make the rules. It's often an MBA who's running a hospital or someone else running an academic medical center, right? And so the concept of what is this policy structure, what is this law structure in which we practice, in which our patients are actually served, how can we have more influence there? And so one of my mentors really helped me work through it literally one afternoon really quickly in a conversation. And I thought about it over the weekend. I said, I should have gone to law school in the first place. I was non-science undergrad. I was public policy, which is political science, ethics, and loved everything about it, but knew I wanted to be a physician. So I again, early in college, didn't know how those two things would mesh, but then brought it together. Loved every second of law school with the exception of contracts. Really hated contracts class, even though I wound up looking at contracts all the time now. And really honestly, since then it's made me a better physician. You think analytically different, right? Just as much as we as scientists in medicine and coming through, your science training, you think differently. A legal analytical framework and how I approach my patients and now how I approach leadership and policy making. I use both degrees all the time, I would say.
And, we talk a lot on this podcast, and what I try to help people understand when we talk about healthcare and what we receive in the office, in the hospital, is not really influencing our health outcomes and our overall health and long term, right?
Love that.
And a lot of medicine is actually not influencing our long-term outcomes either, and all of the policies that have been put in place, and not just in our lifetime, right? Like we talk about things that happened 200 years ago, 400 years ago, especially in this country when we talk about public health in the US and domestic policy. It's so influenced by lots of things outside of medicine, right?
Exactly.
And so now you're at the VA. And so everybody hears about the VA, right? We all had an uncle or aunt or, grandfather who, I remember going to the VA with my grandfather when I was a kid,
Sure.
right? And it was always way over there, right? Up on the hill, right? You didn't want to go, we did have the VA attached to Vanderbilt as a med student. So I did rotate through there. So then I got a different appreciation, right? But it really made me
especially as a woman, right?
Right. And then we rotated a little bit as residents as well. And the little bitty GYN, they had a little bitty cut out for us in the GYN downstairs in Tennessee. But then I think I actually really understood that the VA was more like the infrastructure of the VA is huge, and they were doing so much stuff that you wouldn't quite understand till you got into it. And I mean, that was experience eons ago. So I know that was just touching the surface, but did give me a different appreciation than, what I thought of the VA as a kid going, to the place with my grandfather. So give us a little bit of background of like why the VA? What have you been up to since you've been there?
Yeah, so why the VA it took me a little bit to come to the realization, in choosing between a couple of different job offers I had at the time when I chose the VA. Like you, I did residency rotation. I think I did ICU and some of my general surgery. I'm a family doc, so we just got a scattering of stuff there in Chicago, and I was looking for very mission oriented medicine. I knew that even though I've been on faculty places, I knew I I prefer doing more community based work. I prefer working with vulnerable populations, and yes, that's possible in academia. But I actually have a history in community health centers. So as I was moving to the East Coast for personal family reasons, I was looking at SQHCs as well, and happened upon this opportunity. And don't blast it, everyone must be on LinkedIn. I found the job opportunity on LinkedIn to help with a program that was being established at the VA. A program not established in that the VA, it's a new thing that the VA was doing, but more to the way it was organized, called community care. It's basically the managed care component of VA, when VA is purchasing care in the community for veterans as opposed to within the VA walls. Right. Over the next couple of years, actually ended up escalating promotions and the like, and running that full office. So I became assistant undersecretary for community care, and really helped modernize the program. We had some new legislation, and really needed to change how we were approaching it from a veteran experience standpoint, from a finance standpoint. I mean, we had billing and claims and everything. We had 3 million claims in backlog. Like, it was just not modernized. Yeah, it was ridiculous. Now we're down to like 60,000. That's amazing. We fixed it. And we get like 100,000 a week. 60,000 is nothing. So the opportunity came up to join this massive integrated healthcare system, like you said, without really having any exposure to what it is. And it is just that. It is an integrated health system in the sense that we integrate basically 170 different health systems around the country. So it could be looked at somewhat as a federation, because each VA is its own independent body, reporting up through these regions that we call VISNs, Veteran Integrated Service Network, VISN. There's 18 of those across the country. And then out of central office, we help set the policy, but it's the local facilities that obviously implement, and sometimes there's variation on how they implement clinical guidance, new programs. Also integrated though, because we're part of the larger VA, Department of Veterans Affairs. VHA, that runs the hospitals, Veterans Health Administration, also has the benefit of the other opportunities that veterans can take advantage of, right? There's educational support, there's housing support. We do a lot more, even focused on other social determinants of health, than other health systems are able to do, because the financial system honestly isn't set up for other health systems to really make an impact there. Where in VA, we get the funding directly from Congress for these programs, right? So I have a homelessness program that reports up to me now. We fund both rent and mortgages and subsidies of every kind for veterans to keep them off the street. Just point blank, have nothing to do with health outcomes. It's not to save dollars in an emergency room. Those programs exist where you're trying to make an impact from a social determinant standpoint. It's actually just part of the bread and butter programming that we have within the VA. So the VA is a larger federal agency, cabinet level agency, right? The secretary is on the cabinet in the White House. The president appoints him. We massive budget from Congress, and we are able to support veterans who are enrolled. Not every veteran can enroll, unfortunately. There are some income restrictions, but then other wars that they've served in or other issues that they've been affected by, they do get preference for enrollment, like Vietnam or Korean or other. So it's a great opportunity, because we're a traditional health system with a focused patient population that's part of a larger benefit package That's very mission oriented, because everything we do is just to make sure that the veterans are taken care of. We don't have to worry about insurance plans. We don't have to worry about, will this get paid for? Most of the providers don't worry about billing, although that affects the data collection that we have.
Right,
So it's a very different practice environment compared to other hospitals that you work in, because we're completely incentivized to take care of the whole veteran, as opposed to, like you just said, the majority of the care doesn't happen within the walls of an appointment, or, while they're admitted to the hospital. But we have the opportunity to support them in other ways that other health systems can't.
Yeah, I think one of the things I remember, especially, you talked a lot about integration, and I think the VA has always, well, I can't say always, I don't know, but since my interaction, did that well, and that you could go in the chart and really understand where the patient had been before they saw you. And so you were all working together, as opposed to waiting for this note to come from, the consultant down the road. It was a much more integrated process. And I thought that was, it spoke to trying to treat the whole person, right? As opposed to these little siloed areas of medicine. And the other thing to underscore what you just said is that, for in a lot of ways, the veteran population itself is a vulnerable population for different reasons, because of combat, because of some behavioral issues, health issues, because of substance abuse issues. I mean, we can go down the list of a whole list. So for those who are really interested in making a difference in a specific population in a contained way, right? Like you said, you can come in and you have access to lots of different community services that are focused on a specific population, and a population who is, much deserving of everything that we can offer them. It's just a unique experience. So tell us a little bit more about how those, how you're thinking about designing the program, or I shouldn't say designing, but implementing programs along social determinants of health, how people can get more involved, like what are the opportunities that are there?
So, I think like any other health system, we're just as committed to kind of clinical quality of care. We have full departments, essentially offices within VA, where there could be plenty of opportunity to really come in and do quality improvement work, patient safety work, research. Actually, one of the missions of the Veterans Health Administration is an academic mission. So not only do we train so many of us that have come through VAs, right, as medical students and residents, but also research. We have a substantial research budget, and there's a great deal of work coming out of VA. Read any journal, pick up any journal. Somebody is affiliated with the department, right? So there's a lot of opportunity for that other side of medicine, that other than just strict clinical work. But then from a policy standpoint, as chief medical officer, I am responsible for all of our clinical departments. So as clinical leaders, as service line leaders, there's opportunity to help with creating policy. How are we going to, in fact, amazing conversation we're having right now. How are we going to potentially prevent end-stage renal disease in our diabetics? What kind of preventive programs can we stand up at a population level, not just encouraging veterans to come in and control their diabetes, but at a population level, what kind of services can we offer? How do we tie in nutrition and therapeutic counseling and our other whole health programming, pain control even? How do we tie that in to prevent longer term chronic disease, right, and escalation thereof? We're loving having this conversation. From a mental health standpoint, my goodness, we obviously are at the forefront of suicide prevention, substance use disorders. We are completely, I remember in Chicago treating, I prescribed buprenorphine, and, for substance use disorder, and the wraparound services that are necessary for the actual success of that treatment, that is just hands down part of our system, where it wasn't available to a lot of my patients in the private sector. We have pain management pharmacists and pain management psychiatrists, and like every field possible, because we really are invested in kind of the wraparound services again for veterans. So from a clinical standpoint, there's a lot of I would say benefit and room for growth to take on leadership roles in the VA, because we are totally vested in creating those opportunities. Um, what else? Managed care. Like I said, that's the office I came in. If you're interested in learning kind of the business side of medicine, how facilities work, operations, we do emergency management. So our COVID response was huge.
Yeah.
Hurricane response. Our facilities get affected by hurricanes, and we end up sending people there, and there's physician leadership there, looking at how we're responsive and helping not only veterans in the area but also the community. It's actually what we call our fourth mission, that we're part of the larger public health infrastructure of the country. So we've been taking in non-veteran patients throughout the pandemic this year, in those cities that, perhaps, especially in New York. We actually converted one of our facilities in New York. We have 5 there. We converted one completely to non-veteran, saying, you guys don't have beds, send your patients to us. That sort of ability to respond to public health crisis is just, unprecedented. And thankfully, we've been able to do that during the pandemic. Also with Navajo Nation, with Cherokee Nation, we've been helping in those other states as well too, just because Indian Health Service has been overwhelmed. Everyone's heard about that. So, opportunity, I can keep going. There's, I've really, found a home here as far as wanting to do what's best for veterans, wanting to create and continue to transform, because we're not totally perfect. You've worked there. It's not perfect, nor is any health system.
Right.
But wanting to be part of the transformation of making it even better, I've been happy to be part of the leadership. Yeah.
It sounds exciting. And especially the opportunities to be not just part of the veterans community, but like you said, you're part of the whole community. So we all have to grow together. And so, if one part is falling down, it's not going to help us grow as a community and all get better. I'm going to sneak one little question in here before we close. So one of the other things I know about you is that you are all about the pipeline, right? And encouraging those of us who are interested in not just medicine, but healthcare and policy in general, having the tools that we need to be successful in moving towards that career. So I just want to give you a little bit of an opportunity to speak on that and why that's important, and update us on anything that might be new on that horizon for you. So just a slight pivot.
I love it. And let me pitch my stuff. No. Like yourself and like so many of us that have come through school, we recognize that there's absolutely no way we could have gotten where we are without the appropriate mentoring and advising, right? And so do a lot of work with an organization. One of our colleagues helped me founded the Tour for Diversity in Medicine, and we try to outreach, previously face-to-face, now virtually, to as many students as possible and offer them encouragement and inspiration, advice and mentoring as much as possible to really make sure that we're diversifying the workforce. We're not going to make an impact as far as health equity if we have the same sort of traditional outreach to those students. They're going to make it anyway, right? In order to really make sure we're bringing diversity into the workforce, we need to reach those students that are coming from diverse backgrounds, diverse communities. So we've had a lot of fun over the years reaching students face to face. It's blown up even more in 2020. I hate to say the silver lining of the pandemic is that you can go virtual and reach more people. And here we are. And so we actually have our upcoming, the tours, we call them. We do it for a couple of days in a row. And the upcoming one is focused on Philly, the first week of February. And we'll be partnering with Temple University. Their post-bac program in the College of Science and Technology they're just great partners. And so we try to reach as many non-traditional students as possible, students from diverse backgrounds, students from community colleges. If we're talking about diverse backgrounds, we need to recognize that traditional student who's going to an expensive 4-year and coming to medical school, that's most likely not the population that's really going to help us diversify.
Yeah.
So, we're proud to do that outreach, and it's fun. It's, free time and talk to students, you got to love it. So, find us on social media. It's a great way to volunteer and really to give back.
Yeah. And I'm a fan. But also I think, we keep talking about changing things at the community level. We kind of, because we got to do the population health stuff, but we got to take care of people every day. Right.
Yep.
And and having people that can really, one, that are going to go back to communities that other people don't want to go to, right? And be able to relate to the people on a person-to-person level. And I think it's so important. And if we don't recruit from those areas, we're not going to get those people to go back. So we have a lot of work to do, but we are championing those of you all who are out there doing the work. So we appreciate that.
Thank you. Thank you.
Well, so as we close, just tell me, what are you looking for? It's been a year, right? So what are you looking forward to? What are you hopeful for, either professionally or personally? So we hopefully get over the hump.
I know. What am I looking forward to? This is so, I think, probably typical, but I am absolutely excited for us to get through this pandemic, to get through safely, to save as many lives as possible, so I can just go out to a restaurant. I miss seeing my friends. I miss traveling. I think we're going to come out on the other side of this, although with an unacceptable amount of death and I think the long-term repercussions, we're going to be dealing with for years. But I think on the other side of this, those of us that are around, I think we're going to have a greater appreciation for life and for friendship and for connection. I can't wait to put this laptop down, right? and just meet you in person and just sit and have a conversation and hug people. I think I'm looking forward to just like a new sense of humanity. I don't know if that's the best way to describe it, but we're going to be good when we get on the other side of it. We just need to hold on a little bit longer. But yeah, I think we'll be stronger, especially today. It's a good day to celebrate that. We're going to be stronger moving forward.
Yeah, I know things look simple, like going to a coffee shop. It's like, now that just connection, we're just missing that. And I haven't hugged my parents in so long. I'd missed simple things, right? It's like, I don't know. So definitely, I am looking for that returned and renewed sense of humanity with you. So appreciate that. Well, thank you so much for sharing your time and your story with us. And we look forward to learning more. I know there's so many more exciting things to come from you. So we will follow along on the journey. And we look forward to talking to you again soon.
Oh, thanks for letting me talk with everyone. I look forward to connecting in person in the future.
Yes. Take care.
Thank you.
Thank you for listening to Reed Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.